Pharmacy exam MCQs. If a patient needs a second application of an over-the-counter pyrethrin pediculoside shampoo, how many days after the first application should this be done? Options are 4 to 5, 6, 7 to 10, 14 to 21, 15 to 70. Answer is option C, that is 7 to 10. Reapplication of pyrethrins with piperonyl butoxide should be within 7 to 10 days of the first application. Any lice needs that were not killed on the first application would have time to hatch and then be killed with the second application. All of the following sunscreen agents or combinations of agents would likely help prevent a drug-induced photosensitivity reaction except options are titanium dioxide, octyl methoxycinnamate plus homosalate, oxybenzone and padimate O, zinc oxide, padimate O plus avobenzone. Answer is option B. Octyl methoxycinnamate and homosalate protect against only ultraviolet B, that is UVB exposure. Because photosensitivity reactions are often associated with UVA radiation exposure, people also need sunscreen protection for this portion of the UV radiation band. The other agents listed cover at least part of both UVA and UVB spectra. Pharmacists educating patients about acne should mention all of the following except options are eliminating all chocolate and fried foods from the diet, cleansing skin gently 2 to 3 times daily, using water-based non-comedogenic cosmetics, not squeezing acne lesions, keeping in mind that acne usually resolves by one's early 20s. Answer is option A. Evidence does not show that acne definitively worsens from any particular type of food, including chocolate or fried foods. The other choices are pieces of information that the pharmacist should convey to a patient with acne. All of the following statements are proper counseling point for a patient suffering with dry skin, except options are avoid alcohol and caffeine as these can exacerbate dry skin. Following a bath or shower, pat the skin down with a towel, leaving bits of moisture on the skin. Soak in a tub 2 to 3 times per week for at least 20 minutes to allow for adequate water absorption into the skin. Avoid extremely hot baths and showers. Ensure adequate daily intake of water, about 8-ounce glasses of water per day. So here the answer is option C. Patients who suffer with dry skin should be counseled on bathing or showering for brief periods, that is 3 to 5 minutes with lukewarm water. Dandruff is options are the result of decreased turnover of epidermal cells, typically not a serious medical concern, also known as cradle cap, rarely accompanied by pruritus. So the answer is option B. It's typically not a serious medical concern. Dandruff is not typically a serious medical condition, but embarrassment to the patient is a real concern and must be considered when offering the patient treatment options.